Hey, what's up? My name is Bruce Bassi. I'm a psychiatrist in outpatient private practice. I wanted to make a video about what is the most amount of money you can make in psychiatry, because if you're out there and you're thinking about going into psychiatry, you want to know how much you can make in that field. It seems like a pretty legit, fair question. But obviously, I want to preface this by saying that you shouldn't go into it for the money. I know that sounds pretty redundant and oversaid at times, but it really is true. The old adage is true that if you go into something for the money, for the wrong reasons, just to make money, it maybe implies that you don't have that inner drive, or it's really that interesting to you. So you're just doing it for money, and you don't want to be stuck in a career path that you don't like that much just because you're in it for the money. So I would really suggest that you find a career path that you like and figure out how to monetize that, how to optimize your income in that career path that you enjoy, and maybe picking up some side hustles or whatnot. And if you find yourself going to psychiatry just because you think it's going to make you rich, then obviously that's probably the wrong reason. And you're going to be upset because you don't like treating psychiatric patients. You just think that it's just a way to make money, and patients are also going to realize that too. I also have to admit, I'm a little bit hesitant, nervous to talk about the money topic in medicine. Obviously, people have to put food on the table. Doctors have to pay off their loans. People need to work for a living. But on the other hand, people think that you can't be both compassionate and a savvy business owner at the same time. People think it's either one or the other. Obviously, medicine is probably one of the only fields where this stigma exists, where if you try to make money in the field, people think that you're in it for the wrong reasons. But maybe you go into it for virtuous reasons, but then you decide, hey, I actually have debt. I have things I need to pay for. I have expenses. Everyone else is out there. People in tech are making a living, making a healthy living, and I want to make a living too. So what's wrong with that? I don't see anything wrong with that. You can be both empathic and compassionate in medicine and also enjoy making a living. Plus, keep in mind that doctors are not the ones making top salaries these days. It's the hospital administrators and the CEOs. And you can look that up. That's public record, and that's true. Look up a public university. They'll show you what the doctors are making, and it will show you what the CEO and other administrators at that hospital are making. And I wanted to make this video more helpful than just looking up the average salaries, because obviously anyone can look up the average salary of a psychiatrist, but maybe you wanted to make more money in psychiatry. So if you enjoy mental health, you enjoy psychiatry, and you are highly motivated to capitalize on the business aspect, obviously I would prefer somebody who is a doctor to capitalize on the business aspect of things, rather than somebody who has no mental health interest, such as an investor, to capitalize on the business aspect. And that obviously happens a lot more than the former does. And the base salary for a psychiatrist ranges between $218K to $272K, with an average around $243K in the United States. Somebody who's an outsider who's not in medicine might be thinking, wow, that's a lot of money, but really keep in mind that I'm trying to compare this within areas of medicine. Maybe you've already established that you want to go into medicine and you're thinking about psychiatry, but you don't really know how much you could potentially make. And so this is really relative to other areas of medicine. So while 243 might sound like a lot to somebody not in medicine, maybe it doesn't sound like a lot to somebody in tech, but really that's probably on the lower end of the spectrum. Most people kind of agree that psychiatrists make towards the lower end of the spectrum. And also, if you're not in medicine, keep in mind that doctors are typically graduating with 200 to 400K in debt afterwards. And so they have to also pay that off. So it's not just like they're just cashing in at the end of medical school. It's a long road. They're making 50K, maybe 50 to 60K maybe for another 4 years after that. And they have to pay off interest. Their student loans are accruing interest at 6 to 7% now for another 4 years before they even can touch it reasonably or effectively. And I would argue that people can probably make a lot more in tech, or being a business owner or a hospital administrator. And while, yeah, the salary for a physician is higher than the average individual, it's kind of like going to medicine is a little like entrepreneurship, doing a startup. It's high risk, high reward. You don't necessarily know what's going to come out after putting all that work and time and money into the pre-med requirements. There's potential that you don't get into med school. And after starting, there's a potential that you don't actually finish. You may not pass your exams. You may need to take a medical leave of absence or a mental health leave of absence. And maybe you're not actually interested in it or motivated to do it. So some people do drop out and not actually finish it. There could be the potential that you finish, but you don't match into residency. So that's not guaranteed either. After matching and completing residency, you may not actually be able to find the job that you want to find. Or after getting the job that you want, you could potentially become burned out. And 40% of doctors would say that they're burned out these days. 24% of which would say that they're clinically depressed. And if you don't get burned out, there's a potential that you could get sued too. So there's risk on the front end as a pre-med, there's a risk in the middle of it as a medical student that you don't finish, there's a risk that you don't match, there's a risk that you don't get the job that you want, there's a risk that you burn out afterwards, and then there's a risk afterwards that you could be subject to a lawsuit. I think that there's really 3 ways that a psychiatrist can optimize their income. The first one is doing locums work. And I know a lot of resident colleagues who have had a high level of debt afterwards who have decided to go into doing locums because per hour spent working, there is no other way to get reimbursed that same amount. I've gotten emails recently of $380 an hour, $409 an hour needed for immediate term locums work. And what locums means is that you're subbing in for some sort of absence or gap in staffing. And so these companies and clinics are desperate, hospital systems, they're desperate for somebody to sub in. And so it might be short-term work. It's going to be temporary work that may not be guaranteed for long-term. It's questionable how many hours you would have. And then you have to consider other factors such as how many patients you're going to be seeing, how quickly you're going to need to see the patients, whether or not you'll be on call, whether or not you're going to be paid for notes and administrative time, and how much administrative burden there's going to be too. So there are a lot of factors to consider when doing locums work, but if you want to just raise the number of dollars you're making per hour, that's probably the best way to go. You don't have to worry about creating a business entity. You don't have to worry about any sort of issues afterwards. They usually cover all of your malpractice costs and expenses too. The drawback is that it's going to be temporary work. You may need to leave home and maybe be at a different part of the country where there's more need. And also the people there, they kind of understand that you're going to be transient and they're not really going to engage with you as much as if you were a full-time employee who's going to be staying with them. And then there's inpatient work. I know doctors who can make around $350K to $400K working in an inpatient unit, but that may include call. There is a lot of details there that I'm glossing over in terms of RVUs, which is measure of productivity for you. And there are some doctors who work multiple inpatient units, so they'll round in one inpatient unit early in the morning, then they'll round on a second inpatient unit after that. So they're essentially making 2 salaries and they'll just have to cover 2 inpatient units. It could be an opportunity though for a high level of burnout because you're essentially in the most acute areas. There's this potential for danger and you have to write a lot of notes, and inpatient is very difficult. You don't get to know your patients that well long-term. So there's a lot of new patients, new workup, new rapport building, and that could be very draining for a person. Other details wrapped up into inpatient are, is there loan forgiveness? What amount of paid time off is there? How many beds are you going to be covering? And what is the reimbursement per RVU? In psychiatry, it's generally between $70 and $75 per RVU. And lastly, another way to make a high income in psychiatry is by being a cash pay practice in California. And I wouldn't say that's the easiest method either, and it may take a lot longer period of time to work up and build into what you want it to be, but it has high income potential there. I've interviewed psychiatrists for a position with our company. We have a very good conversation. We'd be an hour into it and we'd finally get around to compensation, and they'll be expecting about $500 an hour because that's what they're accustomed to in California. And immediately we realized that we can't even offer them a position because we don't offer that much money for our psychiatrists. Would I say that's very good for patients? Not necessarily, because patients want to utilize their insurance coverage, but they realize that there's a high demand, so people will pay it, especially if it's child and adolescent psychiatry, and they don't have to deal with the hassles of working with an insurance company. So there are psychiatrists in California who are asking essentially a rate that's on par with a lot of lawyers that I've seen. If you go to lawyers' websites, they're basically asking between $375 to $600 an hour. So psychiatrists in California expecting $500 an hour. I wouldn't say that's completely unheard of because lawyers are making about the same amount of money, and that's also cash pay. But I find this to be particularly unique about California for some reason. Anytime I have an applicant from California now, I always ask them, hey, what are you looking to make first before we have this interview? I want to understand, are we even on the same page about this before getting into this? Because a lot of people from California expect around $500 an hour cash. And generally a practice will be paying a psychiatrist or an employee about 65 to 70% of the revenue. So if a psychiatrist is making $500 an hour, then the practice needs to make 500 divided by 0.65, which is about $769 per hour. And you can see why healthcare is so expensive in the United States. And $500 per hour multiplied by 40 hours a week, multiplied by 52 weeks per year is around $1 million a year. So that's pretty high salary for a psychiatrist. I would say most people don't make nearly that much money, but if you're highly motivated and interested in business aspects, you can move to California, build up your network of cash pay patients, find an area where there's a high demand for psychiatrists, meaning there's very few psychiatrists around, yet there's a number of affluent clients who can potentially pay your rate and put up a shingle and start charging $500 an hour. And again, I feel like this is much more common in child and adolescent psychiatry because parents are going to be willing to pay whatever amount of money necessary for their child, since it's their child who has an issue and they need a diagnosis or they need treatment in order to succeed in school, etc. So $500 to $550 to $600 an hour to $450, they're not going to take into consideration whether it's $450 versus $550 per hour to see a child and adolescent psychiatrist when they're the only one around in town. So those are the ways, in my opinion, to make the most amount of money in psychiatry. A is doing locums work, B is doing inpatient, and C is doing cash pay in California and setting up your own private practice.